learned so much, and then you see somebody who comes in and they've been doing it for a year or 2 years and they think they know everything, and like that's same school as Lane Norton. And sometimes I think it's like, okay, like, he could be kind of a jerk to this person, or like he's just seems so angry at everybody. But at the same time, I think, okay, so when you have been doing this for that long, right? And I'm kind of in the same boat as far as like, I've been reading about nutrition and health and everything since I was 12 years old. And you have learned so much, and then you see somebody who comes in and they've been doing it for a year or 2 years and they think they know everything. And like I get frustrated with it. So like I'm sure at your level of education and his, when you see it and you realize there's no nuance at all to this post, or this is completely just backwards, like it must be constantly irritating.
I think that's exactly describing it correctly. Like they do it with so much conviction without explaining the nuance of nutrition. Mm-hmm. And then seeing it in practice is where I get increasingly frustrated and angry about it, because I see how the patients come in completely confused, overwhelmed, trying to weed out what's right, what's not, to make the best decision for their health. So the more misinformation that is out there, it makes it harder for the people that really need to apply it for their disease.
Yeah, for sure. And so there's a few areas with the cancer that I want to get into. But first, I just want to ask about, you mentioned like, it's with colon cancers and your background with inflammatory bowel disease. My understanding is, and like from what I've read, is that, we don't know what causes a lot of these autoimmune issues and like inflammatory bowel disease. However, so people would say, well, diet isn't a factor in terms of maybe causing it. And I think that's still up in the air of like what would cause it. However, I've heard like gastroenterologists and other doctors say that diet has no impact on the disease, which from my perspective was shocking. First of all, because it's a GI disease. So to say that it wouldn't affect it is amazing. And secondly, while I know that it's impossible to do like these huge randomized controlled trials like we have with like maybe drug studies and everything, there are, at least from what I've seen, some significant studies showing how diet does impact both symptoms and even potentially inflammation in these diseases. So I just want to hear your perspective on that.
Yeah, absolutely. That's unfortunate that it was portrayed that way, or you've heard that, because how
a number of times,
how would diet not have an effect on the GI tract and the function and the health of that? Just understand the physiology of the GI tract. And we do know that, for example, exclusive enteral nutrition is a therapy that is used when someone is having a bad flare-up of IBD. So breaking down nutrients into basic form so that the person can still get the nutrition in those intestinal cells to support healing and recovery. So we know that the function of the GI tract is compromised, so the nutrients that it's getting is going to be compromised. But when you supply nutrients, the gut heals.
So just for people who listening, exclusive enteral nutrition, that would basically be taking like the monomeric forms, right, of the macronutrients in a liquid, right, that's very easily digestible, and there's less to break down, right?
Right, exactly. They digest all the macros into smaller pieces, essentially. So not proteins, now they're peptides or single amino acids. So those intestinal cells don't have to do as much of that digestion.
So I once tried to do that myself. And so the first experiment was, and I'm very surprised by some of the studies that they will use Ensure or Boost with like a pediatric inflammatory bowel disease. And to me, the ingredients seemed horrible as far as like quality of the ingredients in them. I tried it. I had 3 days of that. And in the studies, they show good results, like in the ones I've seen, at least. I tried 3 days of, I think it was Boost, and it was horrible. Like the amount of GI distress I had was like more than I'd had the entire year prior. So I don't know if that was just because it was such a shift from what I was doing. And then the next experiment, like right after that, I was like, well, I don't want to just give up. So I tried to make my own. Basically, I did essential amino acids plus dextrose plus MCT oil, like to try to like get some. It like I've done a lot. This was one of the nastiest things I've ever had. I literally couldn't do it more than a day, and it was so awful. So more just a story than anything else. But I don't know if you seen or thought much about these like Boost and Ensure trials.
Yeah, and like again, the standard boost or insure that is available off of the shelf is not the same as those monomeric formulas or polymeric formulas that are going to be used more clinically. And yeah, that those have ingredients, they have a time and place. I say, what I don't like is I often hear, well, I was losing weight, my provider said, just drink insure or boost. Like, there's more. There's other options that we can do to increase your nutrition intake without relying on these products. So I think it's kind of a shortcut, and then people don't like them because they might have GI distress because they're very concentrated formulas.
Yeah.
The taste is not great.
Yeah. So I was not aware that I thought in these trials that it was the boost and ensure that you would buy at like a supermarket. You're saying that there's a separate, specifically monomeric type for clinical trials.
Yes. Yeah. Or they are different varieties of those products.
Okay. Maybe that's where I went wrong then.
Yeah, because those are very right. The ones that you saw had, for example, high fructose corn syrup,
right, and soybean oils and stuff like that,
or whey protein isolate versus
yes.
These other products are hydrolyzed proteins, and you talk about dextrose, for example, to get that into the free form so it's easier to absorb.
Yeah. Are you familiar with the specific carbohydrate diet?
Yes.
Do you have any opinions on it?
I think there is some limited research on how that can be helpful for those that are in a flare-up. For example, when you think about it, what you're doing is limiting the types of carbs that need those disaccharidases from those intestinal cells. So that does make some sense. If you're putting less work on those intestinal cells, that you would be able to absorb those nutrients better. But as far as being used long term, it has a lot of limitations in the variety of the diet. So
yeah, I've done an elimination diet like that before, and really for anybody listening. So, and I've known a number of people either who have inflammatory bowel disease or just GI distress who have done it. It was written by Elaine Gottschall, like, I don't know, 20, 30 years ago. So I think the science is a little bit dated. The theory behind it was that you should only be able to have, like, basically have only monosaccharides. But I find that some of the legal foods are a little bit contradictory to that and vice versa. Like, I don't know if their rationale for why it works is completely sound. I think ultimately it's an elimination diet that starts you off with pretty easily tolerated foods and then you slowly increase. But I do, as much as I don't like to see like a gastroenterologist saying diet doesn't matter, I also think it's problematic when a lot of these like Facebook groups and stuff, they're like, never take medication, I'm not going to do this, like it's only diet. And I don't think there's a ton of evidence that just diet alone is going to be enough for people who have like legitimate disease.
Yeah, when there's already inflammation and the intestinal cells are having a hard time getting the nutritional needs they need to heal, going on a more restrictive diet is not going to help promote that healing. And for example, with the specific carbohydrate diet, I agree that how can we tease out, is it because you're not requiring the disaccharidases or that you're just limiting how many foods you're presenting to the gut that are maybe gas producing or, And some people then on these diets have to think really hard about what they're going to eat and do planning around what they're going to eat and making more foods at home because these ingredients that are on the no list are going to be in processed foods. So how much of it is, you're limiting this group of foods or that you're eating on a more regular schedule, you're thinking more about your foods, you're making more foods from home.
Yep.